What medications are utilized to alleviate depression? When speaking concerning how to alleviate clinical depression, one of the initial factors you need to know is that every medication that is made use of to address clinical depression can possess damaging side results. With that being pointed out, this short article takes an in-depth appearance at several medicines and what types of medications are utilized to treat clinical depression. Selective serotonin reuptake inhibitors, SSRIs, such as citalopram, Celexa, escitalopram oxalate, Lexapro, fluoxetine, Prozac, fluvoxamine, Luvox, paroxetine HRX, Paxil, and sertraline, Zoloft. In a meta-analysis of 30,000 patients along with major oppressive problems, 874, 30%, terminated citalopram. Careful serotonin and norepinephrine inhibitors, SNRIs, such as desvenlafaxine, Cadesla, desvenlafaxine succinate, Pristic, duloxetine, Cymbalta, levomilnacipran, Fetsima, and venlafaxine, Effexor. There is actually yet another difference in serotonin harmony between the SNRI and the SNRI. Vortioxetine, Trintellix, previously Brintellix, and Vilazodone, Vibrid, are newer medicines that both behaves as SSRIs and likewise impact other serotonin receptors. They are less risk-free than other medicines because they do not have Norvaldi and they increase your chances of cultivating serotonin hypersensitivity. Other SSRs, while potentially safe, can lead to complications with your serotonin equilibrium. Tetracyclic antidepressants that are noradrenergic and specific serotonergic antidepressants, NASAs, such as Remeron. The significant constraint of this research study was that there was actually no variation in efficacy between placebo and diazepam, 0.7 mg, the second very most commonly used blend of both medications. The main restriction of this research study was the lack of considerable difference in effectiveness between the diazepam and diazepine group at a common 30-time course. Older tricyclic antidepressants, such as Elavil, imipramine, tofranil, nortriptyline, Pamelor, and Sinequin. These are the ones we encourage. The various other antidepressant that is authorized through the FDA, citalopram, is understood to create edge impacts, i.e. queasiness, vomiting, weakness, mind loss, and is prescribed as a supplement in small amounts for various other indications. Medicines with unique systems such as bupropion, Wellbutrin. This has been shown for a number of other medicines. The presence of a singular chemical receptor appears to be critical in finding out its clinical effectiveness. It is additionally known to work through itself, but at an extreme fee, and might for that reason have some restrictions. To our knowledge, the single drug research study in we are the first group to disclose it. Monoamine oxidase inhibitors, MAOIs, such as isocarboxazid, Marplan, phenelzyme, Nardil, selegiline, Emsam, and tranylcypromine, Parnate. Because the results of MAOIs show up to be relatively low, the FDA has presently released a list of MAOIs. This is because the effect of MAOIs is not limited to drugs for epilepsy or psychological disorders. N-methyldiaspartate, NMDA, receptor antagonist, such as esketamine, Spravato, while not technically looked at a medicine through the FDA, L-methylfolate, STEPLIN, has proven prosperous in addressing depression.